Thank you, everybody, for coming. I'm Edward Hudgins of the Atlas Society, though I'll be doing some human achievement stuff in the future and doing other work indeed. My topic today, economy, longevity, and Martian settlement, might seem to be as far removed from Martian settlement as Mars is from the Earth. But we all know that, of course, any kind of aspirational goal and the achievement of any kind of aspirational goal depends on the technological state and environment of a society. It depends on the economic environment and issues going on in the society. And of course, it depends on cultural and moral environment of the society. Galileo found that out, in a sense, the hard way. So my thesis today is going to be that there are three major developments and controversies going on right now that will impact our aspirations for Martian settlements in the future. These are controversies that you probably are aware of, but they're kind of on the periphery. But I'm going to maintain that they're going to impact the goal of going to Mars and settling Mars in the future, and it's good for us to know about these three controversies. They concern robotics and AI and generally this appropriate technologies, longevity and expanding human capacities, and the achievement versus the anti-human culture. So I want to start with robotics and AI, friend or foe. Now, oops, is that the right one? Yep, okay. Of course, everybody here, I assume, knows about Moore's law and the fact that capacity, processor speed, et cetera, doubles approximately every 18 months to 2 years. It's been doing that for the last, 40 years, since the 1960s. And that's pretty much given us the world that we know today with personal computers, with the internet, with smartphones, and every imaginable application. Artificial eyes, there's artificial limbs. Of course, robotics has been with us for many, many decades. The auto industry has been using robots for many decades. Computer manufacturing and chip manufacturing is roboticized in many cases. We now have robots in hospitals. We have, of course, Osimo. And, of course, we have robots roaming around on the planet Mars. And that is pretty cool. But I argue that robotics is going to, and AI is going to be at a takeoff point, and is, in fact, right now for a number of reasons. You can see it. For example, one of the unintended consequences of the push to have a $15 minimum wage and essentially punish or penalize, in a sense, people for hiring workers at that lower than that, is that you're seeing a lot of jobs that normally go for entry-level workers going to robots, making hamburgers, and of course ordering hamburgers is the paradigm example. But it's in many other areas. You're seeing businesses trying to say, look, if labor becomes too expensive, we're simply going to go with robotics, because after all, robots and machines are becoming cheaper. You see that in just literally the last year with driverless cars, which used to be aspirational, and now, of course, they're being tested. There are a lot of states that are looking at what are the regulations for driverless cars. You might call them robot cars. And you see it in bigger areas as well. You see, for example, the Watson computer of IBM not only can evaluate medical data, but now it's to the point where it's been they've been putting essentially x-rays and visuals into the computer, and it's now able to do analysis as good as any team of doctors. So it's not just looking at data. This is pretty remarkable, and this has just been in the last couple of years. And while I could put this under any number of things, you probably know about the belief that someday humans and AI and machines will merge, and you actually have a lot of work being done in terms of chip implants in the head, things like this. Someday, if you want to learn Spanish, instead of having to go through the, yo tango, da-da-da-da, you can simply download it. Be a little easier than the way I had to do it. So who could be opposed to this? Well, I mean, was there any downside to this? Well, this is one of the controversies that's going on right now, and big time. There's a lot of fear, and you can read this in the papers, you can read it and you can look at a lot of policy people, that what seems to be an incredible possibility in the future is going to create universal unemployment. After all, if robots and machines are essentially making our stuff, running warehouses, delivering our packages, with unmanned cars, evaluating our health, treating us in hospitals, et cetera, et cetera, et cetera. It's not just a matter of this, buggy whip business going out of business because there are other things. It's going to be, what are humans going to do? And this is a serious discussion that's going on right now. You might think, oh, that's silly. No, it isn't. And policy people are taking note. Now, this sort of thing has been going on, these kind of discussions, unfortunately, have been going on for 200 years. The Luddites, 200 years ago, wanted to smash machines because, after all, it's going to throw everyone out of work, and, that was going to be terrible. We know, of course, from history that didn't happen. In fact, our prosperous society today became about because of the Industrial Revolution and the Enlightenment values on which it was placed. But, as I say, these objections might seem silly to you, but this is just earlier this year. This is an European Parliament draft report that essentially said if robots are going to steal human jobs and otherwise disrupt society, they should, at the very least, pay taxes. We have to tax the robots. Damn it, because they're going to take our jobs away, again, it seems silly to you, but this is serious. This is at a high public policy level. Now, and by the way, the robots may end up protesting this, so it'll be interesting to see what kind of conflict we end up having. Now, I want to first of all tell you why this logic is wrong, and then tell you why this has any relevance to Mars. This logic actually comes from Karl Marx, believe it or not. Marx's thesis as an economist was essentially this: you're going to have let's say you have a workhouse or a workshop, let's say, and it employs two people, let's say two women, and they're each getting $2 or £2 if it's in England a day, and each of them makes 5 sweaters. So the owner is basically paying out $4, gets 10 sweaters, goes out, sells the sweaters. Isn't that nice? But what happens when he puts a machine into his workhouse, into his factory? Well, this is wonderful for him because he can fire one of the workers and he can cut the wages in half of the other worker, because if the worker protests, then they get fired too. And the machine is going to produce 50 instead of 5. So look at that. Wow, this is incredible. Marx's thesis, this is in Das Kapital, I had to actually read the damn thing, is that the rich would become richer and richer and richer, and there'd be fewer and fewer and fewer of them. The poor would become poorer and poorer and poorer, and there'll be more and more of them. And then a spontaneous revolution would occur. That was his economic analysis. Well, what's wrong with this? Who's going to buy those 50 sweaters? Well, Marx never asked that question. And of course, it was because he had a fundamental misunderstanding of labor. I'm not just criticizing him as a communist, agitator, but as an economist. He didn't understand the value of labor, that the guy is not going to produce 50 sweaters if no one's going to buy them. If everyone is poor, how are they going to buy his products? Of course, what really happened was labor was a value, so labor was more productive. And so there was always work for people. There was always work for labor, whether in factories, doing inventory, processing orders. That's how we got Target and Walmart and the great consumer society we have today. But these arguments are still around. But here's the implication for Mars settlement. Now, by the way, exponential technology is going very, very fast. So while economies have had, decades and even hundreds of years in some cases to adjust, we're going to have a lot less. What I argue is that we need aspirational purpose, because in fact, if we have a society in the next 10, 20, 30 years where so much is being done by robots, by AI, and so forth, what are humans going to do? What we provide is the aspirational goals. Now, by the way, interestingly enough, Karl Marx And some of the socialists said, in the future, we're going to have this prosperous society, and then people will be able to work in the morning, and then in the evening they can do poetry and stuff like that. That's kind of that's H.G. Wells down there. Other people fear that if we become more and more mechanized, we're not going to have purpose. We're going to all become couch potatoes. You simply plug into our machines, and that's going to be what's happening. I'm going to maintain that in the future, and actually not in the future, but like starting now, one of the things that we as advocates of going and settling Mars can do is provide that aspirational vision. What could we do? What could humanity do? Well, obviously, something like going to Mars is something we would employ robots, we would employ technology, et cetera, but the aspiration and the planning and so forth, all of that is going to be human. So that's the first thing I wanted to talk about, and that controversy is going on right now. Number two, I want to talk a little bit about longevity and expanding human capacities. This is another graph I always show. This is the human genome. To sequence the human genome in 2001 cost $100 million. Actually, it costs a lot more if you take in development costs and things like that. But by 2007, it was down to $10 million. Today, it's just over $1,000. This one line here is Moore's Law, and you can see that this is bested Moore's Law. This is incredible, 100 million to 1,000. That's just been in the last few years. Add to that another thing. This has again been in the last 5 years. Is the development of the so-called CRISPR genetic editing tool, which allows you to go in, and since you can sequence these human genomes, you can go around and move things around and do all sorts of neat stuff. And again, this has just been in the last few years. 10 years or 20 years ago, if I gave this talk, you guys would say, yeah, this is science fiction stuff. It's nice, but keep it in your sci-fi books. But it's not. They're doing it in labs now. There was a conference I went to last month, RAD, Revolution Against Aging and Death. Sounds like science fiction, but it was basically a whole lot of real actual scientists with real actual laboratories with real actual money doing this stuff. For example, some of the research that's cutting edge now is research on telomeres. Every chromosome has on the ends these little sort of things called telomeres, and they basically tell the cell, make more of us. But what happens is we are genetically programmed so that as the thing called aging happens, what aging is these telomeres are kind of getting reduced, and then at a certain point, they just aren't any more telomeres, meaning they're not telling the cell, make more of us. So you wrinkle up and your internal organs have bad things happen to it and you die. That's, yeah. A Harvard experiment, I think it was over the last year or so, took some mice. And basically, at first it denied there's a thing called telomerase, which tells the telomeres to keep making more of you. And they deprived the mouse of that. The mouse aged very quickly. Then they reintroduced it. And what's interesting is the mouse regenerated. The telomeres regenerated, and the mouse got younger. This is patient 0, Liz Parrish. I met her last month. She is a biologist and developed the same technology for herself. She's a scientist as well. She injected it in herself, and they're waiting for the results. But preliminary results, because it's only been it was only earlier in this year, is that the telomeres are not degenerating. Pretty cool. Nanobots, of course, and nanotechnology is helping out human longevity. This was from December, and this is an artificial kidney using nanomaterial. One of the interesting things is that the blood-brain barrier makes it very difficult, if not impossible, to get medicine into the brain for Alzheimer's and so forth, because the brain is very well protected, because if it weren't, we wouldn't be around, right? Well, there's been experiments using nanobots to allow medicine and allow things cross this blood-brain barrier so you can treat things like Alzheimer's. And one of the more interesting things, and I just saw this paper earlier this year, is injecting nanobots into the brain to actually monitor what's going on in the brain. And this is the prerequisite to actually having nanobots that can treat brain problems and brain diseases. Pretty exciting. Lots of people are putting money into this. This isn't just science fiction. Google's Calico is putting about $2 billion potentially into these investments. That guy down there on the cover of Bloomberg's is in charge of that portfolio. Peter Thiel, Larry Ellison putting a lot of money into this. Zuckerberg, about 2 days ago, announced that he's putting $3 billion into curing like all diseases. And Bill Gates, about a day ago, announced that he's going to be trying to cure cancer, provide the money to cure cancer within a decade. Interestingly enough, 30 years ago, 2 out of every research dollars in medicine was from the government. Today, it's from the private sector. And as we know, private entrepreneurs like an Elon Musk or a Jeff Bezos and so forth can move a lot faster than, say, big organizations like NASA. So what does this have to do with Martian settlement? Well, you might think that I'm going to go on and talk about what I talked about last year, that we could engineer the environment of Mars to make it suitable for human biology, or we could engineer human biology to make it suitable for the environment of Mars. Well, I'll mention that. Just literally, this is another story from just a couple of days ago. The tardigrade is this little teeny weird little creature, and they've discovered that the tardigrade protein helps human DNA withstand radiation. So let's say we're settling Mars and we're, using in vitro fertilization to create our kids. You can still do it the old-fashioned way, which is fun, by the way, just to let you know. But the point is, you could actually genetically engineer your kids so that they would be less susceptible to radiation, because we're understanding how that works in this guy here, so we can use all those things I talked about earlier so that we could do that. So that's pretty cool, but that's not my major point. My major point is a bigger point, that we're going to see this radical life extension coming in the next 20 years, 30 years. Some people say it's a lot less. But the point is, we're reaching that takeoff point just like we did with other technologies. That, remember, but humans unfortunately evolved very short-term horizons. Most humans up until the last century only lived on average 30 years. We've had that much progress. Today it's around 80, plus or minus. The oldest people who've ever lived is about 120, 122. There's one person that supposedly is 140, but we are genetically programmed to die at about 120. But we're now discovering ways that we can keep us alive longer and keep us healthier longer. So what kind of projects are we going to look to if we're going to live not 60, 80 years, and those are our time horizons, but 120, 150, 200 years. And again, this is not science fiction. Well, I would argue this is something we should be pitching in on and talking about, because this is the kind of aspirational project that people are going to be looking for. Okay, I'm going to do my final little bit here. I mentioned culture as being an important issue as well, and it is. Who could be against all of these things? I know everybody in this room and everybody watching this is probably pretty excited. Well, who could be against it? Let's take a look. Pew survey came out last month. Majorities of U.S. adults say they would be very or somewhat worried about gene editing, 68%, brain chips, 69%, synthetic blood, 63%. These are all technologies that in years to come could make us much healthier, much smarter, and much stronger. And by the way, this is left and right. If you looked at the criticisms, it wasn't just a bunch of, right-wing crazies. There were left-wing crazies too. So, it was very democratic in that sense. Who could be opposed to it? Well, this is from the Telegraph just 2 days ago, I think. This is about Zuckerberg putting $3 billion into curing diseases. You would think everyone would applaud that. This is one of these major supposed thinkers. And basically what she said is, sorry, Mark Zuckerberg, your plan to put an end to disease is a sickeningly bad idea. We better hope they don't succeed. What would it do to the human race if they were granted eternal health and therefore life? I'm not making this stuff up, folks. This is the attitude. These are the attitudes that are out there. Here's another one. They have these bioethicists, and you look at them, and they're anything but that as far as I'm concerned. This is coming from the left, by the way, so it's not just a right-wing thing. Making scientific progress faster doesn't necessarily mean better, unless If you're an aging philanthropist and want an answer in your lifetime, in other words, let's all be equal in being sick and dying. By the way, it's called first adopters, okay? They had this whole thing 30 years ago where we were going to have a digital divide and only the rich and powerful would be able to have these things, and now everyone has these things, okay? But again, this is a recent quote. Or Leon Cass, who was a bioethicist, and he was on one of Bush's councils or so forth. Could life be serious or meaningful without the limit of mortality? Well, by the way, a lot of this comes from a philosophical issue, and this is going to be my penultimate point here. There's a thing called the precautionary principle that you find in a lot of discussions. The precautionary principle is that if an action or policy has a suspected risk of causing harm to the public or environment, then it shouldn't be done. In other words, never try anything for the first time. You can't do that. Fire, can't do that. Robert Zuprin gave an excellent discussion of this the other night when he talked about, going to Mars and what we had to do to prevent contamination. And, by this precautionary principle, we'd never even go to Mars because, something could happen. Who knows, right? There's another principle, interestingly enough, that's been opposed to the precautionary principle and that I hope all of you will read about. Put forward by Max Moore, who's, I think, one of the best thoughtful transhumanists, who said basically, no. The proactionary principle says, assess risks based on available science, not popular fears. You don't make the stuff up, okay? Account for the cost of not innovating and not acting, right? By the way, the Food and Drug Administration is always guilty of this. They always say, well, we need another few years, not to test safety, but efficacy. And there are good statistics on how many people died from not having beta blockers and not having interleukin-2, which is for liver, and not having AIDS vaccines. Well, we're going to test it for another few years because we want to make sure exactly how efficient it is and this and that and the other. And people die when you don't do things, okay? And very, very important with the proactionary principle, protect individual freedom to innovate. Because that's where all of this great stuff comes from, individuals who have a great vision. Hey, we can go to Mars instead of for $450 billion, maybe we can do it for 20 or 30. Wow, pretty cool, huh? So this is one way you can oppose this. We are in a battle for ideas. We are in a battle for philosophy. We need to defend human achievement and all of the values that go with achieving, because that's what we're coming up against. And what I argue is that this is the cultural prerequisite to mobilizing people and culture to go to Mars. We've seen it at this meeting when we saw the young woman from high school just so thrilled about it. That's the kind of ethos we have to promote, is a human achievement ethos. And if we do, then we're going to have our children, if not us, going to the moon and going to Mars and settling. Thank you for your attention. Do we have time for a question or two? Okay, thank you very much. Okay, I think we why don't we go for here first and then, okay, we'll go here first and then to the next one.
Is this on? Okay.
I think so.
I'll put out a thesis for you, a very quick one, and have you comment on it. The fear of the future, the fear of the different, the nostalgia for the past tends to come from the right in our country. And so let's say that, as a Christian, I'm going to criticize our own little group. Right-wing Christians, right-wing evangelicals fear technology. They oppose this. Other countries that are in a post-Christian environment, such as Europe, or that are atheists, like China, don't move ahead of this. Move ahead on these technologies while we sit in the past. Comment.
Yes, excellent point. By the way, I say that this is left and right, and I can get, I tried to intersperse the bad guys on each side, but let me address this. And by the way, I'm a secularist myself, but I got my PhD at Catholic University, so kind of, there it is. But what's interesting is going back to, pardon me, flipping through, blurring your eyes here. This conference I went to, the RAD conference, was interesting because one of the things that came out of it is, for example, there was a Finnish billionaire who's helped develop and worked with people who tried one of these treatments. And he's just put a ton of money into a new laboratory in the Bahamas because he said we just can't do it in the United States because of the Food and Drug Administration. Liz Parrish, who I pointed to, the woman who's doing this experiment on the anti-aging with the telomeres, her and her people have just set up a new study place in Fiji because she can do it there. A number of the people there were from South Korea because the South Koreans don't have some of the prejudices that we have in this country, and so they're looking at it. There's this, again, it seems a little bit ghoulish, but you probably read about the 2 doctors who want to do a head transplant. And it's a Russian who's severely handicapped, but the brain and everything else is working fine. And one's an Italian guy. And where are they going to do this? They're planning to do it as early as next year. They're going to do it in China because the Chinese will allow them to do it. And in this country, I think it's both a philosophical resistance coming from, you say the Christian right, and I say yes, there are certainly parts of the Christian right where you would get that. And that's something we have to battle. But we have to battle it on all fronts, because I'm not, again, I'm secular, but I'm not bashing this group or that group. I'm saying these are the values the Enlightenment values that are civilizing values that we have to fight for, whether from right or left. I think you had a question, number 2.
Yes, my name's Kelly Bishop. Could you go back to that last slide of the 2 girls?
Yes, I'd love to go back to that slide. There we go. This is Sophia, and she's 5 years old. And this is Allegra, and Allegra's 1 minute younger than Sophia. And so she's the younger of the 2. And
well, that was my question. Which one's the granddaughter and which one's the
these
grandmother?
These are my 5-year-old daughters, my 5-year-old twins. They were here last year, and they're not running around today because they've slept late, and well, there it is. And if they were running around in this room, they'd be jumping on the table, and it would be wonderful, but you might not hear my speech or whatever. Yeah.
As a medical doctor, I've had to contend both with the religious right, as you described, that are sort of anti-technology or anti-progressivism, but also I understand what you mean about the radical left. The anti-vaccine movement is not predominantly from the Christian right. Mm-hmm. And I've had a very hard time convincing very otherwise progressive people. Mm-hmm. They say, well, if there's any chance it can cause my child, I said, there's not. The Japanese stopped, the MMR vaccine, and the rates of autism went up. Mm-hmm. But there's a lot to overcome on both sides, and any time you're talking about germ cell changes or modifications, you're going to have to do that probably off-world because
by the way, I think that a couple of things. One thing about the Christian thing, and I'll finish up with this, is that one of my friends actually worked on the Pew study. He's actually a Christian, incidentally, but we talked about it a lot, and he said that his view, and I think he's probably right, is that what will happen is that certain kinds of treatments will be accepted sort of piecemeal, and eventually the prejudice will at least dissipate. I mean, when they first came up with things like heart transplants, it kind of sounded ghoulish, didn't it? Back in 68, the first one, something like that. And then people kind of, so what he thinks is that, and this is coming from a Christian perspective, is that you're going to see these things kind of accepted piecemeal, and then over time, it's not going to be an issue. But you're absolutely right that you have this kind of anti-science thing coming from parts of the left as well as parts of the right. My whole point is we got to fight this. I got one more question real quick here. You got a mic? Wait, I think you wait for the mic because they're recording, I think.
Okay. It seems like this issue over acceptance or non-acceptance of vaccines and similar things is more an issue of trust. That is to say, you have certain companies making these things who have a very bad public image, and it's like, do I really want a product made by that company in particular injected into my body? So this is a public trust issue about who is making and promoting these things, not about these things themselves, I don't believe.
Well, I would hope that you would be right. By the way, this is why I'm for a much more open system, because I'm for what works. And there are examples of, what I call cronyism, where you have companies that kind of, like one of the things, I tried to get an FDA or a pharmaceutical conference back when I worked at Cato in the 90s. And I'd go to pharmaceutical companies and they say, well, Ed, your whole thing about, reducing some of the government regulations really sounds wonderful. And none of them put up any money. And one of the reasons why is that a lot of those companies knew that a small startup company could not get through the FDA bureaucracy, but the big companies could. So they would say, well, we're for reasonable regulations, but it wasn't just to protect their patients. It was because they wanted to keep competitors out. And so you do have a lot of this politicized. By the way, that's why Switzerland has a very interesting system where you have to have your product approved for safety and efficacy, but you have competing private laboratories to test the products. And so the laboratories can only exist if they do a good job, and if they're caught cheating, no one's going to go to them. And so you have this kind of market process that allows for safe products. And that's why so many pharmaceutical companies are in Switzerland. Okay, I think we have the end. Thank you very much. I'm going to take my...